What is spondylolysis? Spondylolysis is when there's a small crack or fracture in a certain area of the vertebra, and this can happen in the neck, the mid-back, or the low back. Cervical spondylolysis is an area that occurs into the neck. Low back or lumbar spondylolisthesis is when you have this in the lumbar spine or the low back. This is a condition that's also could be known as a pars defect or a pars fracture, because the area that's affected is what we call the pars interarticularis of the spinal bones, and these are small ridges that connect the bones together from the back to the front. This is a very area of the spine that we call the pars. Causes of spondylolysis can be many different things, but when we look at spondylolisthesis, what we're trying to evaluate is the pars and things that could potentially affect it. And these things that can damage the pars are normally sports or injuries or traumas that typically happen as a result of compression. So it could be, if you could be falling and kind of landing on your backside, can cause a lumbar spondylolysis. A compression to the cervical spine or extension to the cervical spine can lead to a pars fracture, which also can lead to what we call spondylolysis. Also, there are some patients that are genetically predisposed to this as a result of the shape of their vertebral bodies or their bones of their spine. So therefore, when we look at spondylolysis, we have to understand what potentially caused it, when did it occur, is it something that was recent or something that happened a long time ago, and potentially, is it even causing symptoms? Because some people experience no symptoms as a result of their spondylolysis, and they have no pain, no discomfort, nothing, and they find out they have it during some routine x-ray for some other reason. But symptoms of spondylolisthesis can be wide in variation. It can be very mild pain, discomfort, it can be radiating pain, it can be muscle pain, but normally pain tends to increase during physical activity. Now, the most common area where patient will experience a spondylolysis is actually the lumbar spine. In fact, the very low back, the L5, is the most common area, but it can happen anywhere. It can happen in the neck, like I mentioned, the mid-back or the low back. These low back injuries tend to occur during growth. And so the most common age that's affected is children. And it's not a very uncommon condition. It can affect up to 10% of Americans can be affected as a result of having spondylolysis. And they may never know they have it, meaning they could just have back pain and they're just dealing with the effects of it. Now, children that play contact sports like football or basketball, where they have a chance of landing on their backside with relative force, that can lead to that compression, which can actually damage this area. Now, once this has actually occurred, we look at something called spondylolysis. It can also be termed something called spondylolisthesis. And spondylolisthesis is typically associated that you have this type of injury to the pars, but now the bones also moved out of alignment. It means that bones have kind of slipped apart and the front half of the vertebra has gone forward relative to the rest of your spine. Very rarely it goes backwards, but most of the time it tends to go forward. So therefore, treatment plans are typically customized about where the spondylolisthesis is and what area it's affecting, and trying to normally deal with the alignment. Now, normally, if this fracture or this crack in that area is severe enough, there may be surgical intervention that may need to be considered. However, most patients can respond well to non-surgical treatments, and things can be like as simple as just rest, but things like chiropractic care, physical therapy can be used to help stabilize the spine. And in very severe cases, they can use injections or medications to try to hide what they're feeling. In addition, bracing can be used to help stabilize the spine as the pars heals. If we find it young in life and acute in nature, a lot of times stabilizing the body can reunite that vertebra. However, if it's more of a chronic condition that happened a long time ago and the bones have separated, and now we have that spondylolisthesis happening where it's starting to separate, now it becomes much more difficult to heal. So now we're just managing the problem. Like I mentioned, some patients are just genetically predisposed to this manner, but in most cases, it's as a result of injury, overuse, some kind of unspine-friendly types of activities that are occurring. So approaching collision sports and activities that involve repetitive shocks are things that you need to move forward with caution, because these things can damage this area of the spine and bones of the spine, especially during growth and development, because that's when they're most likely to occur. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.